Hi, everybody.
Hi.
Sorry about the light in the background. Just realised how annoying that's going to be unless my fat head can get in the way of it. Sorry, we're having a few technical issues tonight, trying desperately to go on to a different platform.
We've got this. We can do new things.
No, because when I shake my head, it's shaking the opposite to the screen. That is
weird.
kidding me. Struggling. Sorry, folks. It's Treatment Tuesday, and guess what? Em's results are in. What have you done with them?
Oh, my results. I hid them under the bed because I was too scared to look at them.
So knee issues for Em have continued. Possibly got something to do with the fact that she doesn't listen to what I ask her to do, which is rest. No, you don't. You are the worst patient I've ever had.
I've been adapting.
Ever had.
And I've had a couple of rest days.
So we've got the results in, and the results are, drum roll, please go read them. No, don't, because that would be hilarious.
No. Your knees are ducked.
Oh, that doesn't say that specifically.
Oh, you want me to read them? I can't.
Oh, just a couple of the big words. That would be good.
Okay.
What does that word say?
I was looking at that exact word.
What
no way. Of all the words on here, you pick the same.
That's because it's the hardest looking one to say. Subchondral. Oh, I love it. If there's any practitioners out there, they'll be laughing right now. Subchondral. Perfect.
Why has it got a H in it then? That's dumb.
I love it. So Em's been having trouble with her knees about, how long would it have been, babe? 6 months ago now, that swollen knee. Em,
see if I can find it.
Was doing what were we doing?
I was just doing a workout. I literally just finished the plank. I just put my knees down on the ground as you do when you finish a plank. And I looked down. I'm like, oh my God, it looked like my kneecap was above my knee.
It was like an inch or
like
two up higher up her knee than it should have been.
Yeah.
It was a bit of an unknown because there was no incident. Sometimes you end up with an injury and you have no idea the actual cause or the moment that
I don't know if
it occurred.
This will come out. Can anybody see that?
This is where you're supposed to load it into it first and then you press the button and it shows people on the screen.
Not that tech savvy.
You've got to get on with that, baby. It's just poor Insta didn't get a chance to see it. Did you give Insta a crack?
Yeah, poor Insta. That's my knee.
Puffed up like a balloon.
Yeah.
So she's been putting up with it and having a lot of trouble kneeling. So a lot of the workouts that we do require us to kneel on one leg to be able to sort of do weights or get your body into an orientation that you can do weights even for your upper body. And it's just been causing so much grief. And there's certain things that Em does on her knees that I quite enjoy that has been a little bit challenging.
Anyone got some cushions?
So poor Em has...
Then I did my other knee, but it didn't present the same. It just presented with excruciating pain and I can't kneel. I literally can't kneel. Don't ask me to marry you because I can't kneel.
Can't kneel. Well,
lucky we're married.
It's me that would be kneeling if I was asking you. That's okay. So, but we finally got the results in, and as I predicted, thank you very much. It is, turn the page, and now I want you to say that word.
I'm going to say it how it looks, okay? Chondromalacia.
That condition does not exist, people.
Patella. Anyone want some patella for your dinner?
It's chondromalacia patella. So let's talk about that tonight because we figure that makes a whole lot of sense because yet again it's Tuesday. Yet again Em needs a treatment. And I thought we'd explain this particular condition. There is also a Baker's cyst and a ruptured Baker's cyst, which is what was the cause of that massive swelling that occurs, which I think we'll reserve the right to talk about that tomorrow. So if it's all right, we're going to extend our Treatment Tuesday to a Treatment Wednesday as well, just because these two conditions actually are on opposite sides of the knee. So I'm going to do a treatment at the front of Em's knee and I'll explain why we're going to do that. And then the patella issue, the patella's at the front, the popliteal or the Baker's cyst is actually at the back of the knee. So we're going to deal with that separately tomorrow, even though some of the restrictions on what you're allowed to do and what you're not allowed to do will be the same from the perspective of how to help to heal that condition. So let's talk about what it is first. There are actually 4 bones that are in and around the knee, one of which is a little bit irrelevant. I shouldn't say that it's irrelevant, but there are two bones in the lower leg. One is a big bone up the top end, the knee end. The other one is quite small, muscles attached to it, but it doesn't really form a joint within the knee. But it is still relevant because nerves can be pinched behind the head of the fibula, but the tibia is the main bone that then articulates with the thigh bone or the femur that form that articulation that we've spoken a lot about when it comes to arthritis, where if the muscles around the joint, either from the calf up or the hamstring and quadricep down to the tibia, if they're too tight, they jam together and they don't give a lot of joint space. There's not a lot of fluid in there, and we can end up with that bone-on-bone scenario of arthritis. And I'm sorry to tell you, but if you don't do as I say, that is where you will end up. Just putting it out there.
Unhappy.
If I don't tell her in front of you guys, she doesn't listen. I'm being serious about that.
You'll get the whole, it's not going to happen to me.
Yeah. The fourth bone is the kneecap or the patella, which is specifically what we're dealing with here. And that's specifically where the pain is when Em kneels on the bone, to the point that Em was convinced,
at my kneecap in half.
convinced.
I'm like,
that
no,
she'd
I need
broken her
another
kneecap.
x-ray. My kneecap is in half. I know it.
She was so
I just know it.
absolutely convinced.
I can feel a ridge and I can't kneel on it. That means when I stretch my knee and I kneel, it's just like an earthquake.
Opening and cracking open. So
that's
what
it feels
Em
like.
is absolutely convinced has happened to her knee. But proof is in the pudding. There is nothing in here that says anything about
that's because it's wrong.
Kneecap split
it's
in
wrong,
half.
I tell you.
But that is the fourth bone, and in this case, the most important bone for us to understand what is happening in this case. So wherever two bones articulate, which means they come together as a joint and have to move it with respect to one another. So as a joint, it's in this particular case, this is a hinge joint. It works like a hinge of a door, where we're wanting to get that movement every time we bend, take a step, whatever we need to do, sit down even. We need those two joints to move freely from one another. As I've said before, if the muscles are tight, the joints jam up, we try to avoid that. But what's happening here is the patella, the kneecap itself, is being forcibly jammed up against the femur, the thigh bone. And then every time Em takes a step, the femur, the muscle of the quadricep over the top of the femur there uses the kneecap as a bit of a pulley system. So it means that we can bear a lot more, create a lot more strength and power out of our quadricep muscle because it's in this pulley system. And the pulley system is the knee and the patella, and that's the part you've damaged. So the actual kneecap, the undersurface of the kneecap, also has cartilage, just like on the undersurface of the femur and the top surface of the tibia, so that when they rub each other, they don't wear the bone away, because literally you'd be wearing the bone away with every step you take. So this cartilage is a cushion, it's a shock absorber, and it also has this nutritional component to be able to give it a little bit of spring. And the same thing happens on the underside, so the side that faces the body of the kneecap itself. That is the area that's being damaged in Em. It can become quite soft and start to wear away if the muscles of the quadricep muscles means that there are four muscles. If they are pulling too tightly, it will literally pull the patella right up close against the femur and start to cause damage. If it continues to cause damage, the actual surface, the articular surface or the cartilage will wear away, which is what's happening in your knee, as per that report, and it will start to grind along the femur, creating further damage to the patella. So logic would have it, if you can imagine the muscles of the thigh, the front muscles, are pulling that bone, the kneecap, too close to the thigh bone, then we need to give it a bit of gap and a bit of distance, right? Makes a whole lot of sense. The time when the quadricep muscle is at the strongest pull, so it's pulling on the patella the most, is when we have our knee bent. The more bent our knee is, the more that muscle is at stretch.
My leg.
Which means Em needs to spend heaps of time with her legs straight, not bent, so that it takes pressure off that patella surface. So constantly keeping it straight. So no squats. You can do deadlifts, but you can't do squats.
Really?
Yeah. You can't do them because it puts an enormous amount of weight pressure onto that bone. Look at this. She's already.
This is me sulking.
I'm already looking at the floor and thinking about what I'm
Talk to
going to
the
do after
hand.
the live because I'm not listening to you. I'm going to put this out there to our community to support you so that we know what Em has to do. All right.
Fair.
So what I'm going to do, this is my contribution, apart from tell Em what to do and then know that she's not going to listen to me. But what I'm going to do is I'm going to take a look at the biomechanics of the knee joint. So how that thigh bone and the tibia bone actually function together, making sure that they are tracking properly, because if the patella's off to one side or another, it will cause this condition even more so than anything. And then I'm going to potentially balance those up. I suspect I will need to with some needles. This will be fun because we have to do both sides, because this has happened on both of Em's legs. And this has got something to do with the fact that Em does an enormous amount of high intensity work, a lot of jumping up and down on her legs, kicking and, lifting pretty heavy weights with her squat bar.
And lunges and squats.
Oh, no lunges. Oh, that would be music to my ears, but not to Em. As well as the fact that she doesn't roll or stretch, or incidentally, wait for it, drum roll, please. Doesn't drink enough water to hydrate her joints.
Today.
All right, so this is really important.
Do I need to get some shorts on?
You will. Are you actually going to listen to my suggestions when I make them?
Listen, yes.
And will you act out those instructions?
Yep.
You're committing to our community here.
Yep.
Go and get your shorts on.
Okay.
All right. So this is the drum roll, please, people. We are going to keep Em accountable for this little injury that's not that little, because the reality is, and I'm hoping she can hear me from where she's getting changed, the reality is if you let a condition like this continue, you will end up with arthritis in your knee. There is not a shadow of a doubt in my mind. When you get niggles like this, it is really important for you to treat them and to do as your chiropractor tells you to do, or your physio or your osteo, whoever you're seeing, to make sure that you don't progress to an arthritic condition, because leaving it like this, having that bone rub where it shouldn't, will inevitably result in arthritis. So it is really important that you listen. I think she might have actually gone out the front door and jumped in the car and driven off. But if that's the case, I'll jab needles in someone else. I'm sure there'll be someone around to do. I could do myself. That could be entertaining. You might want to bring yourself a pillow if you want to be comfortable too. Yeah. Oh, no, she's still here. I heard a response. She says she's coming. One of the other things that I'll mention while Em's coming is that there is a couple of things that I'm going to suggest Em do that's a little bit easier than not doing squats, and that is to start taking this regularly.
Okay.
Because this is an inflammatory condition and we need the ultra trauma relief spray to cut that cycle of inflammation. We do not want a massive amount of inflammation there, particularly with the Baker cyst, which, like I said, we're going to cover that tomorrow because that's on the other side of Em's legs. So we'll talk about that tomorrow. All right, where are you?
Well, I was trying to get the light going, but it doesn't matter.
We need more light?
No, it's all good. It's all good.
Oh, yeah, that one's not on.
Yeah, I forgot to turn the light
Got to
on.
be
That's
plugged
okay.
in.
I'm just going to lie here and be tortured.
Excellent. Sounds
Heidi,
like
you going to save me?
She is not
Heidi,
going to help you at all.
I feel like we're going to need to move this
A little.
down.
Can we see a knee?
You
Sorry.
can see my knees.
Instagram, we're moving you as well.
I feel like this is weird because my head's actually that way.
Yeah. It is a little weird.
Oh, Heidi scared me.
You know, I really, really wish, in fact, we're going to try and do this because I want these guys to be able to see where your kneecap is. So can I just get you to spin yourself around so that we can shoot your knee right down the barrel of the camera?
Yep. Oh, sorry, Heidi.
But you need to be right in alignment. So your bottom needs to be right there. All right. I'm not sure how well you're going to be able to see this, but I'm going to highlight. This is Em's knee, right? Geez, it's so weird. And this is where her patella is here. So it is heavily off to the outside of the knee joint. It should not be there. It should be in the middle more, which means that we have got some issues with tension on the outside of the muscles, which we do. And it's the same on this side. So this is where we've got a lot of quad work and a VMO, or a vastus medialis obliquus, that is just not functioning properly. This has switched off on both sides. Can you feel the difference in that by touching it with your hand?
As opposed to that. Oh, yeah.
Can you feel the difference?
Yep.
So what we've got going on here, not only do we have a tightness in the muscle on the outside, and that is a lot of the squats, etc., that Em does, but we've got an issue with Em's brain sending a signal to this internal muscle. So there was 4 muscles in the quadricep. One is deep in the middle. One is on the outside. One is on the inside, and the other one comes over the top. Together, they all form the patellar ligament, which comes down and attaches here, which we've spoken about before with Osgood Schlatters. Sorry, I need to lift your leg up a bit. So this is an interesting case. So far, I haven't checked the other knee, but so far this knee actually isn't out. It's not sitting in the wrong spot. So we'll check this one now. But this is a case of tight here and not loose and relaxed here, but asleep. This muscle's atrophied. There's nothing going on there. There's no tone or tension there at all. So interestingly enough, to sort that out, we would either use needles, which I will do, or a TENS machine to be able to actually stimulate the nerve pathway to get it to start to function properly again. All right, onto your back for me. I'll just check the other knee.
Okay, Heidi, you're going to have to move.
Sorry, it might have been a little bit hard to see that, but that was clear as from where I'm standing anyway. This is what happens when you have a trained eye. How nice your pussy is. And that one is good too. Excellent. Okay. Well, it's not that. It's literally coming from this tension and just nothing there. Well, that's good. So interestingly enough, in your case, perhaps not with everybody with chondromalacia patella, because we're not really wanting to bend the knees very much. But in your case, cycling is going to actually be quite good to build that strength in this muscle. But you need to do it without doing too many hill climbs and without bending your knees too much, so that the seat needs to be quite high to be able to make sure that you've got, you know, majority of the time your legs are not straight, but they're relatively straight. You know, a lot of people have their seat so low that even when they're at full stretch with their leg down, their leg is still significantly bent. No, for this, you would not do that at all. And this is only because of what we've just found here, that those muscles on the inside are just not functioning properly for Em at all. All right, so let us stab.
Do you want to bring this closer?
Yes, perhaps. I haven't actually had a chance to see any of the comments. Cool as. Checking out these. We've got a new little system happening here, people. I'm just going to turn this down. I'll shut that down a little bit. Shut that down. Bend it down so that you can see. Sorry, Insta, I just need to bring you down a touch too so that you can see what's going on. All right, so we're going to pop some needles in here for 2 purposes. One purpose is to be able to get rid of the tension on the outside of the muscles here on both sides. And the second reason is to literally wake up the nerves in that. So by putting needles in, the brain will go, what is going on here? And it will start to react with that muscle. So we're going to kill 2 birds. Sounds bad. We're not killing any birds, but you know what I mean. Okay. Got dropsies today. Should have had this prepared earlier, just saying. I love my kit at work. Nothing ever goes wrong with my work kit, but at home, this one's not so great. Gets used often enough. Alrighty. Gets used often enough. Oh, what are you doing?
I just was trying to...
All right, so we're going to work on, there's a couple of spots in the rectus femoris that we're going to work on, which is in the middle. But predominantly it's the outside that I'm wanting to release the tension of, because the muscles on the outside are literally pulling the kneecap off to the side, which is grinding because it's not in the right groove. It's not in the right spot. Em's putting on some interesting wincy faces that you're all missing because she's at the other end. Sorry about that.
I'm all good. Just in case anyone was wondering.
No, they're all looking away because they can't stand the thought of there being needles. So sorry, yeah, trigger warning if anybody's a bit needle phobic, look away. You can look back in a couple of minutes and it'll just look like Em's a porcupine.
Oh. Woo. It's all good. All good. Oh, mother.
Of a yes, we can't swear even on this platform, just saying.
Oh. Yeah. Oh. Maybe my pain threshold is really low today.
Could be. Em's really struggling. But she's being comforted by the cat and by one of our boys. He's up there holding Em's hand just in case she can't handle it.
Oh,
nice twitch.
Oh, God.
One of these days we're going to learn to be able to
Well, I was going to try and figure out
set up the camera in a way that
doing a live,
All right. Wait, there's more.
Oh, God. There's more. There's always more. Do I get a set of steak knives?
Yeah. Maybe. A free noodle bowl.
Woohoo!
Wow, that is just so sleepy, this muscle. Not doing its thing at all.
How is that possible? God.
For those of you who have just joined us, we are treating a condition on M called chondromalacia patella, patellofemoral syndrome, in case you have heard it under a different name. And in M's case, it can come from a number of different causes, but in M's case, it's due to a muscle imbalance, the quadricep muscle, which is responsible for giving us a good amount of leg extension, which is to straighten our legs. So very important in sort of squatting down and standing back up again and what have you. The muscles on the outside of this muscle and the inside of this muscle need to work together to be able to keep the kneecap tracking in the center, where there's this beautiful groove in the actual femur to allow it to glide beautifully over the top of. If we have tightness on the outside of the muscle, which is what's happening in M's case, and almost like a muscle that's asleep on the inside, it's causing the kneecap to be very heavily off to the side, or what we call lateral in the anatomical terms. And that is leading to the undersurface of the patella being worn away, the articular surface is being damaged, and that's causing M a fair bit of pain whenever she kneels, or in general, you'll find that over time it will continue to get worse, and there'll be like a grinding sound or feeling for M when she takes steps, particularly up and down stairs when the quadricep muscle is at full work. You'll find that you'll feel that grinding. It won't be a smooth movement. And over time, if she doesn't treat this properly, it will lead to arthritis, just in case Em wasn't listening when she was getting changed.
I don't want that.
The other thing that happens when there's this imbalance on the outside and the inside of the leg is that the patella or the kneecap can have the tendency to dislocate. So if it's going to dislocate anyway, it usually dislocates out laterally, not always, but generally speaking, that's what happens, because the outer muscles have a tendency to be a bit stronger than the inner muscles. So that is something else that if Em played competitive sport, basketball or football, she would run a really strong risk of having that kneecap dislocate. The workouts that Em does don't necessarily involve a lot of huge direction changes like you would doing playing some sort of sport like that. But if you did, the tendency for that patella to dislocate would be through the roof. So we'll sort her out, hey? And that's why she looks like a pin cushion, because she's got needles in the muscles that are too tight, wanting to release the lactic acid, which are these four here. And then on the inside, this muscle is just like jelly. Snoozeville. It's like jelly. Like in comparison, this side's got tension, it's got normal rigidity and some sort of give back, but when I touch the inside, it's like touching.
Mush.
Mush. No good.
Mushy.
What do you think, Heidi? Are you at all tempted to
To play with them?
play with the...
Oh, God, that one's just...
And that's because there's been no tension in that area at all.
No, it's hard to believe because, you know, I
Do
work
a lot
out.
of workouts. Yep, absolutely.
How could my body miss that part? It just seems weird.
Does seem a bit weird.
Yeah. Unfair almost.
Do you know when you know how if you move your legs when you're doing a squat, so wider,
Yeah.
etc., toes pointed out, you're working the outer aspect of your quadricep. Very infrequently in what we do we ever put the toes in, which works the inner aspect. I'm not saying that you're allowed to do that at the moment. You're not allowed to bend your knees, but yeah, so we don't do that. Do you know what I mean?
Yeah, I know what you mean.
It's about what you're doing. And the very similar thing exists if you've got a particular occupation that works your body, even if it's that you're spending a lot of time on the computer all the time, we don't have the balance of muscles to be able to then work the opposite. So sitting at a computer, we don't really ever do anything that causes us to pull our shoulder blades back all the time. We just don't do it. And as a result, our chest becomes really strong and it then pulls and rounds our shoulders like that, creating these postural imbalances that then lead to sore necks, headaches, and that sort of thing. Exactly the same in the lower back. We've spoken about duck's bum, we talk about that all the time. Increased curve in the lumbar spine. It's called distal cross syndrome, where you've got tight hip flexors because, again, you're sitting it down at the computer all day. Those muscles become shortened. And as a result, when you stand up, because that muscle is attached to your spine, it tilts your back and you end up with this big curve in your back, which then ends up with a big curve in your thoracic spine, and then your neck has to tilt, and it just one thing after another causes this issue. So muscular imbalances, they have a lot to answer for, a lot. And this is another form of muscular imbalance. I know we often talk about posture and nobody really likes the term posture and sorting out your posture, but in this case, this is yet another culprit. Bloody muscular imbalance. Dodgy it is.
Dodgy.
It's dodgy.
It's a flaw.
Human flaw.
Yep.
Human flaw. How are we travelling there, baby?
Oh, yep.
Those inner ones.
Those inner
are a
ones
ripper.
are so like, like most of the time, I can hardly feel the dry needling.
You've got really nice legs.
Oh, thanks.
Sorry for interrupting what you were saying.
Thank you. Yeah, but these ones are, you know, a bit achy.
Stingy.
Yeah.
The inner ones mainly.
Yeah.
Yeah. So those muscles have been snoozing. So now all of a sudden we're asking them quite forcibly to wake up. So yeah, they're not happy, Jan.
So does this mean I'll get like an ache after?
Possibly. Yeah, possibly. We had a case of muscle atrophy like this, which is basically where the nerves aren't telling the muscle to be on tension like they normally would in a patient in the last couple of weeks too. And that was a supraspinatus, one of the major rotator cuff muscles up there in the shoulder. And it was only on one side, which was interesting because you could feel the normal tone of the muscle on this side. And then when you go to here, it like dipped away. It was like, it was obvious to someone who wasn't trained, if you know what I mean. It was quite clear. So dry needling sorted that out, one foul swoop, and the next visit, it was back to normal. Really good. Really good way to be able to get things going again, the old dry needling. Not that I recommend you do this at home, but
I remember my very first dry needling in my calves. Oh, it's like I'd run a marathon.
Afterwards,
yeah,
feels like they're going to cramp a little bit the calves, doesn't it? Is that when I did the level 6 technique on you?
Yeah,
that one? Yeah, that's me.
I couldn't get up the stairs without pulling myself up the banister. I was like, what is this?
That was a little cruel, I'd have to say. So, do you understand what you need to do and not do?
Yeah, just go to bed for the next 6 years.
Oh, it won't take 6 years.
Oh, God, that one is just, ooh. Yep. I need to just adapt what I'm doing.
Em can't not work out. Sorry, that was a double negative, but you know what I mean.
Yeah.
She just can't not.
Like, what do I do? I've got a sore back.
You know, you could do so much with your upper body.
I can't. My back's sore. I'm just so broken. I just want to cry.
I think sometimes the body's trying to tell us things and we just don't listen.
Why? I didn't
particularly
do it. I just knelt. I just knelt. That's it. That's all I did. stupid random.
Dangerous.
And then I put a dish in the
So
dishwasher.
dangerous.
I put a dish in the dishwasher. Oh, there goes my back. Oh, God. What is life coming to?
So handy to have a chiro at home. I hope it wasn't my dish. I put my dishes in the dishwasher. I've just realised there's all these little comments there that I haven't responded to. Hello, everybody. You poor thing. That was poor thing, not poor old thing. I was going to read poor old thing.
That's okay.
Amanda had it a month ago. My respiratory symptoms weren't too bad, but the brain fog and lethargy are Oh, you're talking about the vid. Yeah. Oh, that's Marie's the first day out of ISO. Brain not working at all.
Yeah.
Yeah, it's not fun. I'm actually quite happy with how these have gone. Some of these are almost ready to come out. We know this one's going to be twangy.
God. Sorry. I feel like I feel like I'm not coping.
Em's
Really
like feeling a little bit sensitive today. A little bit sensitive.
Oh, it's like about 8 out of 10, that one, I reckon.
I like Heidi too. Is that from Nellie?
Yeah.
Nellie says she likes you. And all you can do is sleep.
She's trying to heal me.
Is she purring? She's actually snoring a little bit. It's Mum's knees, just saying.
Oh.
All right. Hit the wall big time. Had to come home early. Shower in bed shortly. Totally hearing you, Marie. Get onto your acupressure mat. That'll sort you out. Recovery for tomorrow. Yeah, some of the aftermaths of some of these bugs that are going around are nasty.
Yeah, lingering and annoying.
Yeah, really nasty. All right, I'm going to prepare for extraction. Sounds like I'm a dentist. Right, are you ready?
Yep.
So these are really thin. I find it never does justice to be able to show you these, but they are super, super thin. So if you can imagine a needle that would draw blood, for example, so to either give blood or to receive some sort of medication in, the gauge of the needle, it has to be thick enough to be able to get the blood through, if you get what I mean. So multiple of these would fit inside one of those blood drawing needles. That's how thin they are. They're really thin. You wouldn't want to be poked in the eye with one, but they are super, super thin. I'm leaving those ones.
Okay.
For now.
They don't hurt coming out, if anyone was wondering. It's like a weird sensation, you can feel the movement, but not. Oh, that one twitched.
Twitched on the way in, twitched on the way out. That one's got a little bit of blood. That's a good one, right in front of the camera. Oh, no, nobody can see that. Sorry, Dal.
No, I'm having a shower.
Excellent. Enjoy.
Anyway, it's all on those noises,
Thanks, sweetie. Thoughtful child. We've got one of those out of 8. That's not bad, hey? All right. Now. That's grouse. I love this. I love this. This stuff is cool.
It is.
How'd you go with that?
Yeah, I didn't even feel. Was that the bad one?
Yep.
I didn't even feel it come out.
I distracted you. That is so cool. Feel it.
I can't reach.
Given that you felt it before. Get down to the muscle right there where it was all.
Oh, yeah, that feels good.
How good's that?
Yeah.
Feel that. There's a muscle there again now. It's on tone. I love it.
Oh,
Did
and
I
it's
do
like
a little
I'm doing a bleep
Bleep
exercise.
exercise. Heidi's in the way. All right. So obviously after you've done any type of work, whether it's rolling or massage or dry needling or cupping would also work really well on this condition as well. Don't forget to use your trauma cream or Chirofix, whichever one you've got. Jeez, we're just about out, baby.
Uh-oh.
So we've increased the blood flow to this area. Now we want to provide the nutrition that is required. And of course, the patella itself has been, the undersurface is damaged. Unfortunately, we can't get in underneath it, but to put it around as best that we can is great. And also the bone aid relief cream, because the cartilage is damaged under there, and the bone aid will give the best relief to the cartilage and the bone itself. So important to do both of those. And of course, using those 2 creams as well as the ultrasound is a great way to speed up the recovery of this condition. Doing the ultrasound, I would have the knee on slight bend. So get a rolled up towel and place it underneath, just enough so that the patella peaks like this. I'm hoping that's obvious on both of those cameras there. And then the ultrasound, I would be aiming in the direction underneath the patella. So I would be moving the ultrasound in this way. I can show you what I mean by holding it in the right orientation. So having the knee bent slightly and lifted up like that means that the patella isn't jammed right up against the surface, but it also gives us an opportunity to be able to rock the ultrasound back and forth. Always use the gel. I haven't even got it plugged in, but just explaining what we would do. We're too busy with all the computers plugged in to be able to even get a PowerPoint here. So we would get the gel and we would rock the device like this, because we're wanting the ultrasound sound waves to penetrate underneath and get to the undersurface of the patella. So rocking back and forth like this is going to get the best result for this particular condition. The patella obviously has sides to it as well. You can also come in from the side angles. It's probably a bit hard for you to see on that side, or this way as well. Imagining you're shooting sound waves out of the tip of this, or the plate of this device. We're wanting to be able to orientate that so that it gets up and underneath as best that we possibly can. Because of the undulated surface, make sure you use lots of gel just so that it remains in contact with the skin. The conductive gel helps the sound waves, instead of bouncing off the skin, helps them to go through the conductive unit down in and underneath the surface of the skin, which is where we need the healing the most. Just let that relax for me. I'm just going to bring the camera up and sit up. You're welcome to sit up too if you want.
Okay.
So that we can see if there's any questions relating to this condition. Has anybody had a Baker's cyst?
Oh,
sorry, hides.
Wow, there's spots all over my legs.
Spot hair.
I could draw dot to dot. Hi. I survived. Oh yeah, that's just
A bit stingy.
tender.
All right. Has anybody had this condition, chondromalacia patella, or patellofemoral syndrome, I think is the other technical term to it? Just still really badly need glasses. I'm so bad. Oh, Jess went to the dentist today. Was that at 2:30? Would the ultrasound help wrinkles on your face? Yeah, but don't use it on the pulse setting, Rhonda. Use it on the low continuous setting for that. That's the second one up, not all the way up to the top. Had one behind my left knee. That sounds like a Baker's cyst. Yes. All right. Yes. Had one on the back of my knee. Yeah. All right. So a few people have had Baker's cyst. So this is good. This is also something that Em has got, and we've been diagnosed with this MRI. So tomorrow we will talk more specifically about that condition. Today we've honed in on the front side of the body, and we'll go through and discuss what can be done with the old Baker's cyst tomorrow. Sound like a good plan?
Sounds like a good plan.
It's like we're pampering you for like the week after your birthday, because
Thanks.
you're getting old.
I wish I didn't have to be pampered this way.
Really?
I'd much rather, I was about to say foot massage, but actually no.
Actually, no, that hurts as well. Yeah. Love how the captioning has a hiccup sometimes. Oh, what does that mean? Lucky you have a chiro at home. Have a carrot at home. Oh, goodness me.
What? I've got lots of carrots at home.
Yeah, sure do. Cyst behind my knee. Leslie's got one at the moment. Excellent. And Amanda says you've got this, Em. Absolutely. So they're all going to keep you accountable for not doing any sort of knee bending exercise like squats till we get this thing sorted. Guess what? You know how we spoke about you doing the ultrasound on me, and that's what we're going to have to do. We're going to have to do lots of exchanges of treatments.
Your butt bits. So we
I
can't do that
need
on
my
live.
butt bits. We're going to do a swap over, and Em's going to do a treatment, and she's going to treat me, and we're going to have to do that on OnlyFans or fans only.
We don't have a fans only,
because
only
it's
fans.
Crude, rude, and right up near my date. Anyway, so join us tomorrow. If you know anybody that suffers from either a patella tracking issue, because this will cover what we've spoken about today, will cover that, or a Baker's cyst, so a swelling behind the back of the knee, basically, if you haven't had it diagnosed, then let them know about today's. And of course, tomorrow we'll be talking about the Baker's cyst. So join us tomorrow at 8:30 for a little bit more torture.
Yay.
Because I enjoy doing that to Em, just saying. I'm so mean. All right, folks. Thanks for having us on your therapeutic journey.